retina. In 2016, he was elected as an executive secretary of the Russian Society of Ophthalmologists. Dr. Volodin will be speaking on spectral OCT angiography and FAS in detecting morphological changes of the RPE in patients with CSR. Thank you.
Good morning for everyone, dear chairmen, dear colleague. First of all, I would like to thank the scientific and organizing committee of All Indian Ophthalmological Society for the kind invitation to take part in this huge scientific congress. So today I'd like to talk about the role of spectral OCT angiography in phase mode in detecting on morphological changes of the retinal pigment epithelium before and after selective micropulse laser exposure in patients with central serous chororetinopathy. It's well known that CSC is widespread disease, relatively widespread disease, and characterized by detachment of the narrow sensory retina or detachment of retinal pigment epithelium, usually localized in the macular region in the fovea with an accumulation of subretinal fluid. The basis of pathogenesis of CSC is choroidal dysfunction, leading to disruption of the barrier and absorption functions of RPE, which contributes to the leakage of fluid from the choriocapillaris through the damaged extra hematoretinal barrier in the subretinal space. It should be noted that the key features of CSC are as follows: the possibility of spontaneous resolution of subretinal fluid, high recurrency rate of the narrow sensory retinal detachment, mainly patients of the young working age, high visual functions, and frequent localization in the foveal avascular zone. All the above defines the current requirements for the treatment of this disease: high efficacy with minimal risk of side effects. So structural changes in the retinal pigment epithelium in the form of its defects or detachments in central serous chororetinopathy play a key role in the development of the disease. The RPE defects may lead to subretinal fluid accumulation and, as a result, to consequent narrow sensory retinal detachment. Nowadays, the generally accepted approach for identifying points of leakage is to use of fluorescein angiography. However, due to the possibility of systemic side effects for the patient, it remains relevant to search for non-invasive methods for identifying pathological changes of the RPE for planning and conducted targeted laser treatment. For the achievement of positive clinical effect, a clear definition of the topographic localization of RPE defects associated with point of leakage on FA is required. To identify the above pathological changes in the retinal pigment epithelium, the use of non-invasive diagnostic methods such as OCT angiography in phase mode is promising. So the purpose of our study is to evaluate the morphological changes of the RPE by OCT tomography angiography in phase mode before and after selective micropulse laser radiation in patients with central serous chororetinopathy, determine the correspondence between the topographic location of defects and detachments of RPE on the OCT angiogram in phase mode and leaking points on the fluorescein angiography. We study 20 patients, 21 eyes with CSC before and after selective laser micropulse treatment. In the first step of the diagnostic research, all patients underwent fluorescein angiography. Then we used high-resolution optical coherence tomography with function of OCT-A in phase mode using a layer with an optimal thickness that corresponded topologically to the RPE shape, and local changes and RPE defects were analyzed. So at this slide, the OCT methods in phase mode opens the new possibilities in studying the state of RPE and its morphological changes. CSC, which allows a non-invasive and detailed study of the selected tissue layer of controlled thickness, which is attached to the RPE. I'm sorry. So, OCT tomograph OptoView with Angiography function in phase mode allows to identify defects and detachments of RPE with a precise localization relative to the retinal vascular network. So at this slide you can see the precise localization of RPE defects on OCT-A in phase mode. So it should be noted that the correct interpretation of tomograms, it's necessary to carefully differentiate RPE defects from possible artifacts on in-phase images. In the second step of the research, all patients underwent selective laser treatment in the micropulse mode with individual selection of parameters using a laser navigation system, nevertheless, 577S. After 2 weeks and 1 month after laser treatment, an analysis of the laser exposure area was carried out using the OCT-A in phase mode and linear scanning. In this regard, the use of technology of navigation laser treatment implemented on the nevertheless equipped with a micropulse mode allows us to develop an individual treatment plan based on the digital fundus image and the data of multimodal diagnostics. After that, a treatment plan is created by placing laser application on the points of leakage. Additionally, caution zones are installed to avoid laser irradiation and entering certain fundus structures, as well as for better auto-tracking system operation. On this slide shows the creation of a plan after applying OCT in phase mode to a colored digital photo of the fundus. We determined the energy parameters of the micropulse regime, which are presented on this slide, with a selective and effective effect on the RPE. As a result of our research in the first step of our study, we revealed the following morphological changes. Single RPE defects revealed in 5 cases, multiple RPE defects in 7 cases. In 9 cases, we see slit-like RPE detachment, and the combination of slight leak detachment and the defect of RPE revealed in 3 cases. So the sizes of the detected RPE defects range from 23 to 171 microns, and they had predominantly round shape. Height of the slit-like RPE detachment varied from 75 to 123 millimeter, and maximal linear diameter from 253 to 480 microns. It should be noted that in all cases, defects and detachment of RPE diagnosed by OCT in phase mode was correspondent with the leaking points and areas of diffuse leakage on the dye according FA. So at this slide you can see the comparison of FA on CT and A data. In the second step of research, it was noted that in the period of 4 to 3 weeks after laser treatment, the defects were closed and RPE detachment fit in all patients, which resulted in resorption of the subretinal fluid and reattachment of the narrow sensory retina. And in this clinical case, you can see the positive clinical effect on the OCT and with complete resorption of subretinal fluid in 4 weeks. So, in conclusion, our preliminary results show that OCT angiography in in-phase mode is a non-invasive, highly informative diagnostic tool that allows to identify morphological changes of the RPE with a precise localization relative to the retinal vascular network, which make it possible to plan and accomplish topographically oriented laser exposure based on OCT navigation, aiming in the area of defects and detachment of RPE, as well as to monitor the dynamics of these changes after selective laser treatment. Thank you very much for your kind attention.
Any questions from the audience?
The treatment is based on fluorescent angiogram.
We perform treatment based on the OCT and on in-phase mode. We revealed the RPE defects and localized it, and then conduct a topography-oriented focal laser treatment for the defects in micropulse regime.
Suppose the RPE defects will not leak in fluorescent angiogram. You may get atrophic areas. Suppose the RPE defects will not leak, whether that requires treatment.
We studied the correspondence between the points of leakage on the FA and the defects. And so when the defects of RPE is round-shaped and the size is more than 50 microns, so in most cases the correspondence of leakage and the presence of the defect were revealed.
Thank you. So,
Thank you so much.
Thank you so much, Dr. Fadhar. It was a wonderful talk. So now we'll go ahead